Good morning, everyone. My name is Estera, and the topic of my presentation is the results of research on the efficacy of rosemary acid in reducing the symptoms of acne vulgaris. In recent years, cosmetology has seen a shift towards natural ingredients that can serve as an alternative to classic pharmacological therapies. The goal of the study was to assess whether rosemary acid, known for its antioxidant properties, could be an effective and safe tool in the fight against acne. Acne vulgaris is a multifactorial condition where we deal with a triad of problems: excessive sebum production, inflammation, and excessive bacterial activity. Effective therapy must target all these areas simultaneously. The choice of rosemary acid was dictated by its properties. It exhibits a unique multidirectional biological activity. In vitro and in vivo studies confirm its effects. Anti-inflammatory, reduces redness, antibacterial, which is crucial for acne. Sebum regulating, it also has anti-elastase properties, which means it prevents the degradation of elastin fiber, supporting the skin's structure. The goal was to verify theoretical premises in clinical practice using a 5% concentration. We qualified a group of 5 women aged 18 to 25 for the study. Inclusion criteria with strict active diagnosis of acne vulgaris made by a dermatologist and no parallel pharmacological or cosmetological therapies. The severity of acne at baseline varied from mild through moderate to severe. The procedure protocol was simple and repeatable. Application of a 5% rosemary acid solution. Exposure time lasting 10 minutes. The frequency of repetition was 4 treatments at 2-week intervals. The final assessment was carried out 2 weeks after the last treatment. To ensure the results were objective, we used two recognized dermatological scales. The GAA, Global Acne Severity Scale, was used for general clinical assessment, and the more precise GAGS, Global Acne Grading System, as it considers the location and type of lesions. We obtained a statistically significant improvement in both scales. GAGS scale chart, the averaging score in the group dropped from 23 points to 50.8 points. This is an averaging symptom reduction of 34%. The p-value was 0.0, which confirms the high statistical significance of these changes. What does this mean? Clinically, the group averaging shifted from the level of moderate acne to the level of mild acne. A similar trend was observed on the GAI scale. The average score dropped from 2.8 to 2.0, which confirms the consistency of the data obtained. Inflammatory changes subside and the number of the new lesions significantly decreased. Regardless of the initial state, every patient experienced a reduction in scoring. Improvement was noted in 100% of the subjects. It is worth emphasizing that no indentations or side effects were recorded during the entire treatment cycle. After results correlate with literature reports on the anti-inflammatory and antibacterial effects of rosemary acid, compared to popular chemical peels, such as glycolic or salicylic acid, rosemary acid seems to offer similar therapeutic efficacy, but with potential better tolerance for sensitive skin. In summary, a series of 4 treatments with 5% rosemary acid significantly reduces the symptoms of acne vulgaris. The therapy is characterized by excellent tolerance. Naturally, the preliminary results obtained in a small study group are promising and provide a solid basis for designing larger randomized clinical trials. These studies could potentially introduce rosemary acid into the standards of therapy for acne-prone skin. Thank you for your attention.